hypermobility treatment, and what does that look like? Hi, I'm Dr. Shakib from Joint Hypermobility and EDS Clinic right here in Irvine, Orange County. My practice focus is on postural stability and functional mobility. And I see majority of my patients are in fact hypermobile individuals. So from my perspective and what we see the best result with, we focus on number one, breathing. Breathing for hypermobility is a little bit of different cueing. The style of breathing is followed by us by watching babies. So all babies on this planet breathe in a very specific way, and we do that automatically. So that must be the best match for the body. So we duplicate that breathing with a different cueing. So what I have learned treating patients with my hypermobility is that the cueing has to be different, because your sense of proprioception, the knowledge of where you are in space at any given time, is not your strongest forte. The reason it's not is because naturally it's that tensile contraction, that tension in the ligaments gives the brain an understanding of where the joint is in space. Well, when you have joint hypermobility, it's the connective tissue disorder where that contraction and that tension within the ligaments are not as strong. Therefore, your sense of proprioception is not the same as someone who is not hypermobile. So with that said, I have learned that your sense of pressure is actually quite strong, and your tolerance to pressure sometimes in certain parts of the body are kind of low. So if I can bring in a different sense to cue your brain in giving more attention to something, then obviously that is going to be the cueing and how we try to bring that knowledge of recognize your feet, recognize this spot and that spot in your body as we're practicing functionality in movement. There are certain principles that we need to communicate to our patients with hypermobility, and as an individual with hypermobility, those spots are very, very important as like your checkpoints. So when you're practicing your balance and coordination throughout the day, you use those points of attention as you're going about doing your activities of daily living. Those points are the middle portion of your heel. So when your heel is touching, your heels on your feet obviously are touching the ground, I want you to see those points in the eyes of your brain. So are you feeling those areas as you're standing on them? A lot of times you don't, because your feet are so unstable that the brain doesn't really rely heavily on your feet as an area it can rely on for posture and stability. So the only way to change that is by actually drawing its attention to the area and keeping it on those spots. Another area is the position of your leg bone into the socket. We call that, the saying is ball over bump. So is your hip over the ankle joint? I'm going to demonstrate that in a separate video so you can have a better visual, which is helpful for you as a hypermobile individual. Any tool that can allow your brain to see what it is you're doing is a good tool for you to have. The next area that I want to bring your attention to is the position of your neck, where your head is connected to your neck, and the position of that bone, which I'm pointing to right here, over your your pelvis. So in your pelvis, you have the front that is vagina or penis and the back that is anus. That tissue in between, your brain needs to see that tissue, and your neck needs to line up right above, stack right on top of that area. That is very important. So that's the neck, the perineum, neck over the perineum. I call it neck over crotch. And then ball over bump, where the ball of your hip right here has to line up with the bump on the outside. This is not going to be easy at the beginning, but I will do a video and I will tell you what I do with my patients so you better understand that mechanics that you can practice with. So neck over perineum or crotch, ball over bump, and see the heels of your feet on the ground, and with a little bit, maybe 5% extra feel, extra pressure on it. That does not mean you move everything above to increase that pressure. I just want you to kind of almost as if you're trying to dig in with your heels into the ground. It's so important to make these points, practicing these points being on top of each other and associating them with activities you do throughout the day. The one activity that I absolutely love, and I associate so many things that I do with that activity, is when I'm facing a counter. So if I'm facing a bathroom counter, kitchen counter, if I'm at my office facing the front desk counter, if you're at home maybe facing a dining room table, that's a counter of a kind. When you're doing it, just automatically think about neck over crotch, ball over bump, pay attention to the heels. Just try practicing that, and do know that the right question to ask always is, am I closer or am I farther away by this action? Closer to stability or farther away from stability? Closer to my goal of balance, farther away from my goals of balance? When you ask, am I there yet? There are too many times you're gonna hear the answer no, and that's very discouraging. So ask the right question that allows you to see the progress you're making, and little by little, next thing you know, you're in a much better place than you have been. I'm so glad you're watching this video, and I'm so glad that you have subscribed to this channel, and I'm looking forward to hear from you on any videos that you think would be helpful for you and our community. Thanks for watching.